I've been here 7 months, over 7 months now. And that was the first time, June 22nd, that anybody showed up. And they drive by me every day.
It's now been 238 days since Thomas Mohr began living in his truck in this Oakville shopping plaza. Mohr, who worked as a carpenter for decades, became homeless after his leg was amputated due to medical reasons.
When I left the hospital.
After our initial story aired in June, Mohr says outreach workers with Halton Region, accompanied by police officers, approached him to provide housing support. Mohr says he was then dropped off at this Burlington hotel roughly 20 minutes away from where his vehicle was parked, and that he did not hear from the region again.
I'm looking at this bed, and this bed's 3 feet off the ground. If you've lost a limb, especially a leg, that makes it almost virtually impossible.
Not only does Mohr say he was unable to get into his hotel bed, he found out the room was only booked for 4 days. He adds the region did not provide additional supports like food or medical care. He says he then tried calling staff, but no answer. That night, he ended up back in his vehicle.
This, case is a microcosm of so many issues that we're facing. One is the siloing between his health providers, the housing authorities, the social service agencies.
Dr. Andrew Pinto says the system has failed Mohr and so many others trying to access housing with a disability. Halton Region tells Global News housing, food, and medical supports are available to the 69-year-old, but did not say anything further due to privacy. Mohr says while he's been in touch with the region since its attempt to house him, to date there has been no solution.
And I said, you didn't provide a plan, you didn't provide adequate housing for my needs, and you left me high and dry.
Now, Mohr says he was supposed to have a meeting with the region, but that was canceled last minute, and ever since then, it's been radio silence. The family is still asking for donations via GoFundMe to try and help him get a customized prosthetic so that he can be able to work again. He needs $80,000, and at last check, Tracy, the family had raised $13,000.